Thank you so much to everyone for being here this afternoon for this very important event. My name is Micah Weinberg. I'm the president of the Bay Area Council Economic Institute, and I'll be your MC for the day, filling in for my good friend Jim Wunderman, the CEO of the Bay Area Council, who's got a little bit of a cold. So I'd like to pass it over to our beloved mayor, I'm an Oakland resident, Mayor Schaff, and also the vice chair of the Bay Area Council Economic Institute to welcome us and kick off the program for today.
Mr. Bishop, how are you? Excuse me. This is Mr. Emery Bishop. This is why we're here today. Mr. Bishop is someone who has been a really generous family member all of his life. He helped out members of his family when they were in need, and he did it so much that his generosity actually landed him on the streets. Mr. Bishop lived on our streets. Actually, Mr. Tyson, I'm sorry this was not planned, but Mr. Tyson, you would drive by Mr. Bishop's box at the bottom of the freeway off-ramp on your way to work many, many, many days. Mr. Bishop was one of our first residents at the North Gate Community Cabins. And I'm happy to say that I had the opportunity to visit him right before the holidays in his apartment that he has all to himself. This is why we're here. I didn't know you were going to be here. I hope you don't mind. Now. This is why we're here. This is where we're... Justin? Where are you, Justin? Justin actually helped put his bed together. There he is. I'm sorry, you're making me a little unmayoral right now. Wow. This is why we're here. This is why we are all here. Because Mr. Bishop Emery should never, ever have to spend a single night on the street. He should not have been penalized for his generosity to his family members. He deserves every dignity, every support that a person is entitled to, particularly in this wealthy Bay Area. All right.
Hugs are better than round tables.
I don't think we could have started this off any better. We are here today because we believe in the dignity that Mr. Bishop deserves, and that should be something that every person in this Bay Area, and frankly in this nation of ours, enjoys. You got me off my game. What is different about this study? Oh my gosh, homelessness has been studied to death. Every governmental entity that I am a part of is taking on this issue because it is the #1 issue. It is the highest priority. The fact that the great state of California has roughly 1/2 of this nation's unsheltered residents is deplorable. What kind of California dream is that? And within California, the wealthiest region, the region that is growing the most, creating the most jobs, the fact that we drive by our fellow human beings, our neighbors, our family members, and allow them to subsist without the basic human needs of shelter or food is deplorable. It's morally outrageous. I really want to commend Mr. Tyson, Bernard, his leadership of the Bay Area Council recognizes that this is not just a problem for social service agencies. It is not just a problem for government. It is a problem for every sector of our society, and that includes the private sector. Humanity is good business. I think what is different about this report is not only its focus on the promise of regional collaboration and coordination, but a more formalized platform for that collaboration, for action. Lord knows we do not need another layer of bureaucracy. We need to move quickly, more efficiently, and with more impact. And the recommendations in this report are to that end. The other thing that is different about this report is it seeks to formalize the role of philanthropy, and I'm looking at you, Daniel Lurie, to formalize the role of philanthropy and the private sector in a way that collaborates with government, with the public sector, to not just innovate and try new things, because we know we are not fixing this problem quickly enough or without enough urgency, but also to do that innovation with an eye towards institutionalization and scale within government. That is what is different about the recommendations in this report and the work that we are starting right here today as a unified collaboration to end homelessness. Thank you.
Thank you.
I really want to thank Blaze and the staff of St. Vincent de Paul for having us into your home. Thank you so much. It is an honor for us to be here, and we're wanting to be here so that we can see and understand and really be engaged with what we're talking about. We really appreciate your hosting us, so thank you so much. Now I'd like to turn it over to Bernard Tyson, CEO of Kaiser Permanente and the chair of the Bay Area Council, for some opening remarks.
Good afternoon, everybody, and thank you so much for such a touching introduction that I think we all get it, both at the intellectual level as well as the emotional level. It's an honor for me to actually be a part of Kaiser Permanente. It's a fantastic organization with wonderful people who are committed to total health for everyone. And we work on that every day, and we are clear that we are bigger than just a medical care program, although that is very important. We're also part of the communities in which we exist, and that's a holistic approach that we take. I'm also honored to serve as the chair of the Bay Area Council, and it's been an honor to serve in that role, serve next to Jim and the wonderful team, and then all of the members who make up the Bay Area Council. Every single organization as part of the Bay Area Council have skin in the game, that this is something we collectively want to work on and solve to. It's interesting that when you talk about public-private partnerships, I think that's just the way to go in the 21st century. We have skills and capabilities and resources and people, and you have the same, but bringing it together, we can solve the bigger problems, and that's what this is about. I got up this morning at 3 a.m. in Washington, D.C. and flew out here. One, for our board meeting, but more importantly for this, the beginning of a new day about how we want to look at the homeless situation in the greater Bay Area. And then in a couple of hours, I'm going to be back on the plane to go back to Washington, D.C. Now, am I lonely and just want to fly planes on planes? No. But this matters. This is important. And just seeing Mr. Bishop says it all. I really appreciate that everybody has been leaning in. And I think we all are saying something that's important. That is, collectively, we're answering the question on our collective watch. What do we believe is the threshold of what a person should have or exist with in this great country we call America? And I think one of the statements here is we believe that no one should call the streets of America their home. That's what we're solving today. This study allows us to step outside of each of the cities that we've been clearly working on and looking across the region. This study is intended to answer some of the factual questions that we didn't have. But now that we have the collective data, we have an ability to look at what all of us have been looking at, but also to see some things differently, because now we have it in an aggregate form and we can draw some conclusions about it. I think the last piece is that this data also suggests to us new possibilities of how we might best leverage the collective resources that we're all committed to and have demonstrated that we're committed to it. But we can, in fact, do more with more, but also with what we have. And that's really the work that is in front of us. The Bay Area Council believes in taking action. So it's not enough that we do the study. The study gives us both perspective and a roadmap. The work comes from all of us rolling up our sleeves and now saying, what do we do next together to make it happen? I would end on just thinking about inside of Kaiser Permanente with just fantastic people every single day who are working on health and health care and taking care of thousands and millions of people around the United States. We have this line of sight that we call 1366. We have 12.4 million members, so I'll just round up to 13 million. And then we exist in communities in which there are 66 million people. And our line of sight is looking at both the members that we're privileged to take care of every single day and the communities in which we are privileged to exist in every single day. And one of my key leaders is here who looks after the 66 million and bring those perspectives into the organization and help us to understand and prioritize how to deliver on our community health initiatives and vision, and that's Dr. Bashara Shakar. So he's going to tell me everything I need to do to be a part of helping to solve what we all agree is an unacceptable way for us to exist in the 21st century. Thank you.
Thank you so much, sir. And there's so many important key leaders here. All of you could be delivering these presentations. Thank you so much. Hopefully we'll hear from some of you in a little bit. And as much as the president of an economic institute as I like to imagine that just issuing this study is the thing that gets stuff done, obviously there's a huge effort. And one of the leaders of that effort, the leader for the Bay Area Council, is Gary Meltzer from PwC. I'm going to turn it over to Gary. But as I do that, I also want to thank my friend Steve Hansen, a city council member from Sacramento, coming down. We wanted to have people from around the state engaged in this because this is not a Bay Area issue. It's not a single city or a single region issue. They're struggling with a huge homelessness problem up there as well. And so I really appreciate your being here, Steve, and working in partnership with the state, with the other major regions in the state on this issue. So thank you for being here. Gary.
Thanks, Micah. When we looked at this about a year ago, one of the things as a Bay Area Council Executive Committee we said was there's nothing more critical right now for us to be engaged with than this issue that we have before us on homelessness. And we established a task force. And it's an informal group of members of the Executive Committee, fellow Mary Huss is part of that group, but other members of the committee, both on the business and academic side, to say the first thing we need to do is study this differently. And if you think about what we've been able to do in the first phase, which it really is the first phase, is doing the study, the analysis, and the data, and looking at the data very differently, aggregating the data differently. And to Bernard's point, the other thing that this does, it dispels some of the rumors that have been out there that are not fact. And what it does, it brings together the facts and it lays in front of us what the issue is that we now have a challenge in front of us to address and to deal with. So I think that's been a very significant accomplishment. The McKinsey team we worked with and the Bay Area Council Economic Institute have just been phenomenal. And the heavy lifting that's gone on over the last 6 months or so, and we're going to hear from them, was not a small effort, as you can imagine, to go about the interviewing that they did, the research and the data, and mostly being as inclusive as they possibly could in really speaking with the entirety of the ecosystem around this really challenging issue. So I want to thank the McKinsey team, certainly Micah and your team, Adrian Covert, who's around here somewhere, who was really heavy lifting on what went into this study. The most important thing I think right now is for us to be able to hear from the folks at McKinsey and the Institute on some of the key areas that they gleaned from the study that we've just released today. So I really want to make sure we can do that and then get into the discussion that is really most important. So thank you very much.
Great, thank you so much, Gary. So if I could call up Jeff Belisario, the Vice President of the Bay Area Council Economic Institute, and Kunal Modi, who is a partner at McKinsey, to tell us about some of the key findings of the report.
Thank you, Micah. So first of all, thank you for the invitation to join you all here today. We're going to spend a few minutes talking through some of the top level findings of the report. I think you all know that this issue can't be dissected in just a few slides, so we won't do it justice here. I encourage you to look at the full detail in the reports. And as you've seen, there's a lot here to talk about, so we want to do the quick version of the fact base and then make sure we're focusing the bulk of the time on the discussion that we want to all have together. We set out with 3 objectives in this report. The first was to map holistically the end-to-end experience of homelessness and the support ecosystem that's in place today. The second was to build a robust fact base across the 9-county Bay Area, because we know this issue is bigger than any single city or any county. And the third was to provide some actionable recommendations for decision makers, many of whom are in this room and are already fighting this issue on the front lines today. And so we wanted to make sure were armed with the fact base and the ideas that we came up with through this research of what can make a difference. Before we go into the detail, I'll just say we partnered with over 40 members of the community across sectors in doing this research. Many of you are in the room today, so really appreciate your contributions. This is intended to be reflective of input from all corners of the community. So I'll start, this is an eye chart to try and do in this big a setting, but it's actually, we felt it was important to actually put the end-to-end experience on one page, because navigating this system is what many of our neighbors who are most in need face every single day. So I'll just make a few points. First, the experience of homelessness is often thought from a public standpoint around unsheltered homelessness or street homelessness, but it's so much broader than that, right? So it's from being housing insecure and the thousands of folks who are one emergency away from falling into homelessness, to those who are just climbing out of homelessness and are one again emergency away from slipping back in. So it's important to make sure that as we're tackling this issue and looking at it, that we're defining it from an end-to-end perspective. The second point I'll make is that the support ecosystem that's in place and the interventions that can help along the way are diverse, but don't necessarily talk to one another. right? So as we're thinking about the experience of trying to navigate your circumstance, it's important that we as a community figure out how we can make the interventions in the support ecosystem collaborate better together. The third point I'll make is obviously this is not a straight linear process. It can't be cleanly mapped to one page. People fall into homelessness and have breaks where they can get out of it or get support along the way. We need to make sure that our support ecosystem is dynamic and can actually meet people where they are and help them with an individualized pathway to sustainable housing. Just to level set on the fact base a little bit so we're on the same page. By the latest point in time counts, on any given night in the Bay Area, there are over 28,000 people who are experiencing homelessness. And 70% of them are concentrated in Santa Clara, San Francisco, and Alameda counties. Now we know this is just one single point in time over the year. Throughout the year, upwards of 50,000 individuals are experiencing homelessness, either entering it or exiting it. This came up earlier, but within the Bay Area, we have the third highest homelessness population across the country when you look at other regions, behind New York and LA. What's striking about homelessness, as we see with some of our West Coast peers, is just the high rates of unsheltered homelessness. So this isn't news to all of you, but it's quite interesting to see how the data shows the rates of unsheltered homelessness on the West Coast compared to some of our East Coast peers. Now, there's lots of reasons for that and policies in place. Part of what we wanted to do through this report was just put the fact base on the table and start to understand what are the different hypotheses that we need to go explore to understand what is uniquely going on in our region and what can we do to address it. And then this slide is just to show that we cut the data in every way possible. But the reason, a few things really stood out about the Bay Area that made this very tangible for us. And I'll say the research team actually spent time with the great nonprofit Larkin Street Youth to actually make sure that we were meeting with folks firsthand who are struggling through homelessness. So the work is informed by their stories and their experience, because it's much more than numbers on a page, right? Oh, thank you, and you're joining. Thanks for joining us here today. A few points that I'll make. In the Bay Area, we see much higher rates of chronically homeless and homeless who are unaccompanied youth. And we see much lower rates of family homelessness than we do in some of our East Coast peers. So again, part of the effort of this report is to just map what are we seeing today as input for decision makers so that we can start to come up with tailored solutions for what we're going to do going forward. Jeff, I'll pass it to you.
All right, thank you, Kunal. So I think the Economic Institute really stepped in, and where McKinsey kind of took the next step here is to ask why, or how did we get there, or what's the reason for some of these numbers you saw in the first 3 or 4 slides there. So we tried to put together the reasons behind why the crisis exists as it does today. And this is not an all-inclusive list, but really it starts with housing supply and affordability. So it's clear that we have not built enough housing at extremely low income levels. Another piece of this is that wages at extremely low levels have not grown nearly as fast as rents. The second piece, we just have an insufficient supply of inventory to address this crisis, whether it's permanent supportive housing or shelters or other types of assets. We just don't have enough to meet the need. The third is political challenges. This is true across any type of housing, but especially for solutions to homelessness. It's tough to build in the Bay Area. The fourth, we looked a lot at mental health and psychiatric care. Really the state and federally, we've lost a lot of resources in this area. A lot of resources have been not really backfilled either. So a lot of changes here to mental health. And then lastly, we just kind of look at a little bit of history. So people look at New York and they see everyone sheltered in their homeless population. But New York has a lot of public housing, just kind of a different history and a different type of housing stock that we do not have here. They also have right to shelter laws, which drive some of those numbers down, but New York also has the highest concentration of homelessness, the highest number of family homeless. Many of those are children, and they don't really have a way of exiting that homelessness cycle in New York. So just a little bit more background here. So these are questions that come out of the point in time counts. These are self-reported. But just to give an idea of why people are becoming homeless, we kind of group it into three things here. One is economic displacement, two are behavioral or psychological problems, and then three is cohabitation instability. So just to kind of give you a sense of what's causing some of these issues. And I would also say that there are different interventions for each type of person or family here. But what is similar across all of them is that they lack a home. And I think that's why we focus so much on housing in this report. So to housing, here we look at extremely low-income housing, very low-income housing. So this is out of the regional housing needs. This is our 0 to 50% of area median income housing, housing that's deed restricted for the lowest income group. According to RENA, we needed almost 100,000 units. We weren't close to that in the region. We were 61,000 in deficit just for this specific income category. So really this is the number when you look at housing. We haven't built those units, and that's why we have such a big homeless population on the streets today. Another McKinsey eye chart. I love these charts though. Here we're looking at the total system, and part of that initial spectrum was to say that yes, there are people experiencing homelessness, but there are also people that we're supporting that are housed that are not counted today. So that's the number here in green is total permanent supportive housing. So you kind of look at how different cities address this and their mix of assets. Some cities have a lot of permanent supportive housing and little shelter. Other cities like New York City, down at the bottom here in gold, they have a lot of shelter but very little permanent supportive housing. And the argument here is that the Bay Area doesn't need to look like one of these, but we need more of everything. We're in the middle here. Of total people in need, 38% of them are unsheltered, have no asset that they can access here. So cities and counties have done a great job of growing that green bar, that permanent supportive housing bar, but they're unable to really address the inflows in a way that makes a dent in the overall crisis. So maybe my favorite chart in the whole thing though, and one of the complexities of solving this is the funding side. And we set out with McKinsey to really put a number to how much are we spending in the Bay Area on homelessness. And we didn't come close. We ended up with this chart. And part of that is because there are just so many different funding streams, so much complexity in the way this gets funded. Money comes from the feds, it comes from the state, certain times comes through counties, and it kind of moves through all of these different buckets, and at the end of the day, it's very difficult to say, this is what we're spending on, and these are the people that we're spending the money on. The other thing that exists here is there's not a lot of flexibility until you get down to this final bucket of private or philanthropic capital. Much of this money is dedicated to a specific use. It's very hard for cities and counties to scale up their innovations, given kind of the restrictions around some of these funds. So lastly, the report puts together 10 recommendations. I have 6 here, but I think I'm just going to give you kind of the top 3 buckets. So first, and really the most important thing, we look at stemming new inflows, making sure we can address the inflows through diversion and prevention programs and emergency assistance programs, but also creating more exits. So that's partially through the very low-income housing supply, it's through more permanent supportive housing, and it's through more transitional types of units that will eventually get people to permanent homes. Second, we looked at the state. So right now the state has 7 different agencies that work on homelessness in one shape or form, kind of dole out some money. We looked to the state to create a homelessness services agency. We looked to the state to create more incentives for regional coordination, more incentives for creating data that can be tracked across different counties. And we look for more flexible funding streams, whether that's through tax credits for extremely low-income housing or whether that's for things that will help us build and provide services in one. And then lastly, we call for the development of regional homelessness action plans or management plans, really looking for the region to come together. And some counties are already doing this, but to track data across different agencies within the counties that then can be monitored and tracked across the entire region, and maybe one day eventually at the state level. So those are kind of all of our recommendations. Again, we've got a private and philanthropic plan here. We look for more innovation around funding and technology, and kind of thinking about how the Bay Area solves this. How can we innovate? What is the next solution to this? That maybe isn't to get more funding or do it more efficiently, but what is the next innovation down the line? So I'll turn it back to Micah for lead a discussion. Thank you.
Thanks, Jeff. Really appreciate the partnership with McKinsey. Really appreciate your being here. I mean, people need to understand just how much work and just how much time they put into making this report happen. So thank you so much for your partnership, Kunal. I also want to thank, really the theme here is action. And one of the actions that that is happening coming out of this report is some legislation that is being carried by a member of the State Assembly, Buffy Wicks, who couldn't be here because it's Wednesday in the middle of the day and busy legislating in the Capitol. But Uche Uwahimu is able to be here from her office. And this legislation is going to be looking at some of those issues around data sharing and regional planning. And so we'll be talking with them throughout the year. As we've mentioned, this is a big priority for the governor. So we want to just make sure that this ends up really turning into concrete action that gives us better data about what's going on, better coordination across the region, but ultimately better outcomes for the people, which is the real focus. So do you want to add anything to that? Okay, great. Thank you so much for being here, and thank you so much for your partnership. So just to turn to some of the folks around the table who have been involved in different regional actions. Jeff, do you want to take a minute or two and let us know about some of the good stuff that you've been doing in San Francisco and how you think about regional coordination?
Sure. I mean, I think we'll talk more about the work that I've been doing with my colleagues throughout the 9 Bay Area counties. About a year ago, or a little bit longer, Mayor Schaff and Mayor Liccardo and Mayor Lee and then Mayor Breed sort of directed their staff, including me, to work on a regional strategy for addressing homelessness. So as such, many of us have been meeting under the facilitation and leadership of Micah at Home Base, a nonprofit consulting organization that works around issues of homelessness throughout the West Coast and the country. And we are, in some ways, working on many of the recommendations that have already been laid out in this report. One of the things we're seeking to do is to develop a Bay Area systems map and understanding what's actually available in the Bay Area, and then a gaps analysis, where are those gaps, and then figuring out how we can advocate together as a region as opposed to individual counties to fill those gaps. And then the other area we're working on, as you already alluded to, is to create a region-wide by name list of people who are experiencing homelessness, not just a way to report data up to the state or the federal government, but actually an active list that we can use to be able to see people who are moving from county to county and to try to disrupt that so people can stay in their home counties, where they're connected to, get the services they need, prevent them from becoming homeless, and if they do become homeless, to get them quickly sheltered and then housed. So this has been a regional effort with almost all of the 9 Bay Area counties participating. We're currently in the process of, I think we have a very good roadmap laid out. We also have a budget that we need to get funded. A big part of that is looking at not only providing some staffing to Home Base, who have been doing this essentially for free, which we really appreciate, but it's not sustainable, but also to develop at a higher a company who can help us figure out what's the data solution that we need, how are we going to build a data warehouse that all 9 counties can access and use to help us achieve our goals.
Great, thanks, Jeff. Pass the mic back to me, so we'll just do it this way.
Thank you so much. Well, another partner that I want to really thank for not only serving on the Bay Area Council Economic Institute Board, but being a real thought partner of ours and obviously a tremendous leader on this issue is Tamika Moss. So I wanted you to let us know some of the work that you've been doing at Hamilton Families. And really, I want to be clear, we want to be the wind beneath your wings. I mean, the private sector coming in is understanding that there's tremendous work that's going on out there, tremendous work that's already underway. We want to help bring resources, we want to help bring innovation, we want to bring flexible capital and build on the good things that are happening in the region, many of which are written up in this report.
Thank you, Micah, and thank you all for doing this incredible work. I think, as I read this report and participated in its its formation, you know, it is really helpful to amplify things that we already know. And that many of us have been working on for a lot of years. And so I think elevating and helping people see this information in the aggregate is incredibly powerful, because it does recognize both the successes that we have made in the solutions that we know work, but also how much more work we have to do together. And I want to just acknowledge that, you know, my experience at Hamilton was really informed by my work in the region. Having worked directly with Mayor Schaff in Oakland, living in Oakland, representing Spur in the region, we have to be thinking about these issues, not just from what is government's responsibility, but what is all of our responsibilities. I think Bernard mentioned that really well, that everyone actually has a role to play here, and I think this report sort of identifies where a continuum of how folks should really be plugging in so that we can sustain the impact, the outcomes, and have the impact that we collectively want to have. We actually, as we support families who are finding housing as far as Sacramento in an effort to stably house themselves and their children, we have to make sure that we're working with Sacramento to be responsive to what formerly homeless folks are experiencing in Sacramento. And so the fact that we are elevating both alignment as well as action of our regional efforts, and frankly our state and federal partners coming to the table as well, I think is a part of the solution. The last thing I'd say is, you know, there is no silver bullet. I think we need to be really clear that it's going to take all of these efforts for us to even attempt to work towards solving homelessness in our communities. And so when people look for singular solutions, I think we need to be much more holistic around our thinking and looking at the continuum of services and resources that we need to put together to solve the problem. So thank you for having me.
Thank you so much, Jamika. I mean, it's amazing. We're rehousing people in Sacramento. So, Steve, do you want to follow up on that about how you're addressing this issue in your part of the state?
Thank you, Micah, and thank you, Tamika. We have a different cost of living and a different housing challenge than you have. We still have a shortage, but it's no doubt that people are looking for housing in the Sacramento area. But one of the key outcomes of the report, it didn't get touched on as much, but this is a regional problem. We always think, oh, people are coming from far, far away, but they're moving within regions, and we are part of the Bay Area mega region. And so our mayor was recently tapped by Governor Newsom to work alongside the other big city mayors and Mayor Schaff to see how we can move forward these issues at the state level. And I think as long as we're dealing with them in the silos of one agency or one jurisdiction, we're not going to fix it. And that's exactly, I think, the point you're making. So we're working also just to stand up shelters and do those other things. But the data here, even though it's not specific to Sacramento, helps us dramatically, because Mr. Tyson didn't say this, but the whole healthcare model of focusing on outcomes to measure interventions has been remiss in most of the work done around homelessness. And so I think the people around this table are really awesome. And if this can make a difference in the Bay Area, this can revolutionize what's going on in the state. So the Economic Institute and McKinsey deserve a lot of, and PNC deserve a lot of credit for what they've been doing on this.
Thank you so much, Steve. Anne, you've been staying on top of us to make sure that we are focusing on preventing homelessness and stabilizing families. Also a member of the Economic Institute Board, thank you for your service there. Do you want to say a little bit about homeless prevention?
Sure. So I do want to say thank you so much for the spectrum that you described what is homelessness in a different way. And that is a part of the dispelling of the myths that Gary was describing. That the number of people that are living on the edge in the Bay Area is the constant replenishing of the homeless population. And while I recently had a conversation with Mayor Schaff about the urgency of people on the street, the equal attention to the people who are just a paycheck away, a medical emergency away, a lost job away, is equally important. So I just want to commend the council for the equal attention to that. And that is, as we've been describing, it's a cross-disciplinary approach. It's never one thing. And so as we work as a community, public-private partnerships, on supporting people and their financial stability, we are preventing homelessness at the end of the day.
Thank you so much. Daniel, I wondered if you wanted to say a little bit about the work that you've been doing at Tipping Point, focused on the chronically homeless and other parts of the ecosystem.
Sure. I don't have anything else to add on in terms of it takes kind of all of our efforts, and we have to do it all to solve this problem. One thing that Bernard talked about, this public-private partnership, we are working extraordinarily closely with Jeff and Mayor Breed in San Francisco to try to cut chronic homelessness in half over a 5-year period with a $100 million private fundraised initiative. One of the things that we are trying to do that I think is indicative of what I think the private sector needs to do more of is fund solutions or prototypes, things that may work, and then have the mayors and the state take over and fund, because we will never be able to fundraise, even with the amazing $200 million gifts of Kaiser and the $100 million at Tipping Point. It's never going to be enough. But we are trying to build a building in San Francisco in under 3 years, a 146-unit building in under 3 years, and for under $400,000 a unit. This report that you all just came out with says that building a single unit in San Francisco of affordable housing is over $700,000. And we know that it will take 6 to 7 years to get that built in San Francisco currently. So we are trying to break the mold. We are trying to do something that has not been done in a very long time, and build units for formerly homeless individuals who deserve every right that we all have around this table of having a safe and secure home with your own bathroom and your own kitchen, which, if you talk to people, that is what they want. That is what everyone deserves in this region. And so we commend you all on this report. I think the one thing I will say, no matter what anyone says, this solution to homelessness is a home. It does get to that basic, simple level, and I will continue to say that over and over again. And we cannot build our way out of it in one single city. We have to do it as a region, and we have to do it as a state, and as Bernard said, we have to do it as a country too.
So Sherilyn, can you tell us a little bit about the experience of Larkin Street and how it plays into all this?
Thanks so much. I'm really quite honored to be here today and to be with such incredible people and thinkers on this issue. And I don't have anything to add to the brilliance in terms of the comments about the report and the depth and breadth of the report. I will lovingly follow up on a comment that Daniel made with lots of respect, and add that for young people, I think for families, and for some folks, it is both a home, and it is also all of the things that we talk about in terms of the depth of services that I think Anne referenced. We need employment and education and behavioral health supports and physical care and connections to caring individuals in order to resolve homelessness for young people, which is a prevention strategy for addressing chronic homelessness. And we need to interlink the work between, in particular, families and youth homelessness, right? We need to support families so that when they're to prevent homelessness for them, we also need to support young people who are a part of a family at one point and something happened, right? So how do we work together to address those issues? So I appreciate the complexity of understanding that in this report and thinking about lots of places that we can intervene. Absolutely, ending homelessness is about homes. It is also about the tools to keep that home. So thank you.
Great. I'd actually like to sort of end us where we began, which is focusing on, like, what's actually happening here. I assume this room is not just used for Economic Institute type report releases. Blaise, could you tell us a little bit more about where we are and about what happens here and the good work that you do?
I'm just going to intervene and say the last time I was in this room, I was wearing a hairnet and pouring drinks.
And thank you for doing that. We appreciate all of our wonderful volunteers, whether they have mayoral jobs or not. And I very much appreciate all of you being here today. It's wonderful to have a chance to very proudly show off a little bit of the work that we do around homelessness, both addressing the situation that people are in who are living in homelessness, and also prevention. I'm glad to hear what Ann said about prevention. That's actually, and it doesn't happen in this room so much, but it's one of the things that St. Vincent de Paul does all over the world in about 150 countries. And here in Alameda County, we do it with a team of 800 volunteers broken up into 38 local chapters all over the county. And in those teams of volunteers, they are raising their own private funds, and they're going out and making home visits to people who live in their own neighborhoods who are in need. And they'll bring a food box, but they can also help in many situations with a portion or even all of a month's rent or a utility bill, which can keep that family in their homes. And I believe that prevention is such an important piece of this. It tends not to get addressed enough, and we especially do it in such a volunteer, decentralized, low-key, don't blow our own horn kind of way that no one even knows that it's going on. But here in Alameda County, we spent about almost $1 million of privately raised money to address those folks who are living on the edge, for whom we can make a real difference when they can show that there's a reason that they couldn't pay this month's rent, and if we pay it, there's a good reason to believe that they'll be able to pay their future rent, and we will have literally kind of solved that problem for a family. Back to what happens here, we scrambled a little bit. Rufus came in and helped us move tables because we just finished serving lunch in our dining room. We serve about 500 meals a day in this room. That ends at 12:45, so there may still be some ketchup stains on the floor. We had spaghetti and meatballs, actually. I had a little on my chin earlier. And at about 5 o'clock tonight, we're going to turn this room into about 2/3 of our emergency shelter. And I really want to thank Mayor Schaff, the city staff, and the city council for the incredible support that they've given us financially and with a lot of guidance on how to develop that shelter. This is the first year that we've become a year-round shelter, and I think it really is a critical thing. I know that the conventional wisdom has moved more and more towards permanent housing and subsidized housing and getting people into longer-term solutions, and that's obviously very critical, but we can't forget the folks who aren't there yet and for whom the housing hasn't been built yet, because it does take a lot of time. And for those folks, we provide a really critical piece of that safety net where someone can come in off the street, out of the rain, out of the cold, have a warm meal that's served to them by volunteers. You may or may not get Libby Schaff to serve you your meal, but you might. And we have other volunteers who come and do different kinds of movie nights and different sorts of entertainment, but a nice safe place to sleep especially, and we do that for about 100 people a night. We also have a job training program, primarily in culinary training. We have a food bank that provides food to those 38 local chapters, and the food that's reclaimed food that we serve in our dining room. We have a podiatry clinic that serves the homeless, because feet are one of the areas that homeless folks really are very tough on. And so we have an entirely volunteer-run podiatry clinic just once a month that serves about 45 or 50 people a month. And the last thing is where many of you came in the building is called our community center, and that's a drop-in center whose door is open to anyone in need who can come to us, whether you're homeless or not. If you are homeless, you can take a shower here during the day, you can do your laundry at no cost, whether you're homeless or not. A lot of families come and save their rent money by doing their laundry here, so that the money they would have spent at a laundromat would go towards rent. And we have clothing and some bus tickets and referral information, and most importantly, really in St. Vincent de Paul's model, if I can go on for just another moment, is the care and compassion of literally thousands of individual volunteers who know these guests, we call them guests, maybe not quite as warm a relationship as Mayor Schaff and Bishop have, but in a very personal way, and that's really our secret sauce. These volunteers are here out of the goodness of their heart. It's very inspiring to a guest to sit with a volunteer who could be out playing golf, but instead has chosen to be here trying to help me as a guest. It's wonderful for our volunteers themselves who get so much out of it and thank us for the opportunity to be here doing all this work. And it's great for our donors to know that their contributions are not going to pay a lot of staff members, but they're primarily going for us to create the space where volunteers can really work their magic very much one-on-one with the populations that we serve. So thank you all so much for being here. I really appreciate a chance to host this and all the work that's gone into this study. It's wonderful. Thank you.
Thank you to everybody. The work continues. Really appreciate everybody being here.
Hi.